Hello and welcome everyone in another episode of Researchers Celebrity. Today we have Dr. Aadisha with us. Unlike our other researchers, a brief about Dr. Aadisha. She has done her bachelor's in dental sciences from Mahe Institute of Dental Sciences, New Mahe in Kerala, and then she joined masters in hospital administration at SRM University, Chennai, Tamil Nadu. And currently she is a PhD student in public health, and in between, she has worked at Rela International Hospital in Chennai in this different administrative and roles. So, with this brief introduction, I would like to welcome Aadisha at platform. Starting with thank you, Aadisha, for accepting our invite.
Thank you so much, sir, for inviting for this Researcher Celebrity series. I'm so glad that I'm a part of it now. And I'm also happy to share some of my life experiences or life journeys
Yeah.
towards this public health PhD. Yeah.
We look forward to it. So, Aadisha, we always start our conversation that how and when you decided that you want to become a researcher.
Actually, it was not a planned one. Uh, Starting from my BDS. So I finished my BDS in 2017. Then I worked as a general dentist in a clinic, and that clinic actually made me understand more things that BDS is something which is like I can even do some other medical courses also as my master degree. So during my internship, I was actually researching or browsing about master degrees. So I was not really interested only in MDS. So MDS is the stream which all the BDS people will take, actually speaking. So I was not actually interested in that. Like I didn't show much of an interest. It was plan A, but I had plan B. Like, okay, I thought I'll take MBA or like MPH or MHA. Not taking. I thought, okay, I will actually browse about it. So that's how I came to know about MHA. So my mother, she's also from a medical background and she finished MBBS. So she really want me to take undergraduation as medical. So I told her initially itself that I'll not take MBBS and all. I'll take BDS because I love seeing people smile. So I can even make people smile too. So I thought, okay, I'll do BDS. So she was like really happy that okay, finally she's going to take something which she likes. So even during my internship also, she told me that you can actually take MDS. I was like, let me see, let me think about it. So my parents are not somebody like they will not insist me to do certain things. They really give me all sort of freedom that I can do whatever I want. So I just browsed about a master's in hospital administration. Then that was something which actually turned my life because I was not a top graded student. Like I was not a first rank student or something. Like I was an average student and my schoolings, my BDS and all. But when I took masters, I was really lucky that I did my masters under community medicine department. So all the masters in hospital administration never comes under this community medicine. But SRM really gave me an opportunity to work under community medicine department. And there the HODs, faculties were very friendly and they actually didn't spoon feed me. I feeded myself so that I read so many books, I read so many articles. So that's how I got gold medal also for this my master degree. And that was a time where I myself recognized that I really upgraded myself. I'm the one who compare only my journey, like my from my schoolings to my PhD. I compare myself myself that I have actually leveled up. So I'm really proud about me in certain things. So I took masters in hospital administration, completed that. Then I worked in Rela Hospital as a quality executive, actually starting from quality executive. So that was a time where I came to know that okay, quality is the department which is actually good for me, because quality is the quality department is the heart of a hospital. So so whenever we whenever we think about a hospital, patients to be like they have to be satisfied. So the quality department has to see whether we are giving all sort of facilities, resources to the patients. That's how we get the patient satisfaction. So I thought, okay, I'll work in the quality department. And actually, I was working very genuinely. And all of a sudden, I saw this PhD admissions. So that's how I thought, okay, why can't I do PhD? Actually, I was really interested in public health dentistry when I was learning BDS. At the time of BDS, I was really interested in public health dentistry and pediatrics. So I thought, okay, why can't I just do PhD? Because my mother or my family actually didn't tell me anything regarding this PhD. They didn't ask me to do PhD and all. It was my decision. I was like, all of a sudden, I told my dad, I'm going to do PhD. So my dad was like, why all of a sudden you already got a job? Why do you want to do a PhD? I told, I don't know. I wanted to stabilize myself. So according to me, PhD is like, it's an acronym for me. PhD is like P is a power and H is a higher degree. And D is something which I say discipline in my life. So I think after my PhD, I'll have a discipline in my life. Like I'll stabilize myself. I will have a balanced life. And I think it's the highest degree. I know that there is postdoc also, but still, according to Kerala, PhD is something that people will not take because they know that it's a long journey. So most of the people does not take that in Kerala. I don't know. I have never seen people taking PhDs. So I thought, okay, why can't I do PhD? Because I was an average student, but later on I have certain progress. So I think I can also do a PhD. So that's how I end up in public health PhD.
Absolutely
So
fantastic journey, and especially we love the way you explain PhD, like the power of degree and discipline in life. And I must say that my PhD supervisor, Dr. Tiadak, always used to say that PhD is a degree which trains you for the rest of your life. So
yeah,
discipline, absolutely. You will learn so many things, starting from time management to resources management to human resources, everything. And even budgeting, if you are, maintaining your own expenses and all that. So sure, it
definitely.
trains you for everything. So
Yeah.
let's start with one step back, that most of the people who are in the field of research, most of them are, like, conventional way of it is bachelor's in some kind of, allied sciences or sciences. But the medical people, there are very few and the rare one, and you are one of them, that after pursuing your bachelor's in dental sciences, then master's in hospital administration, you still are brave enough to commit yourself to PhD. And when we see you, we can feel the enthusiasm behind it, that how optimistic, so we will say that once it was going in your head that, okay, now you have a gold medal in master's. Congratulations for that. And then
Thank
before committing, or before making up your mind that you really want to do PhD, because I can see that to your family it might have been a beamer, that they were not expecting that you will say that, okay, now I want to do PhD. Because most of the people, like, through the academic background, they want doctor as a prefix, so
you.
they
Yeah.
want to do PhD. Okay, you already have doctor because
Yes.
bachelor's. And then now this doctor, and then again going for PhD. What were the things which actually motivated you that you really want to do PhD, and that too, especially in public health?
Actually, I told you that I was really interested in public health dentistry department when I was doing BDS. So the thing was like I came to know that after PhD we can actually teach the students, and I'm really interested in teaching. I don't know. I'm very friendly to all the people, even to stranger also. I'll talk immediately. I don't have problem in that. So because of that character, I thought that I have lots of experience in talking with people, mingling with people, and also my life is a lesson for myself that I didn't survive, like I didn't had any difficulties in my journey of life, because my dad, mom, everybody is settled, but still I wanted to be a special person. I really wanted to be like, I really want to what to say, I really wanted to showcase myself. So I thought, okay, the public health is something, it's a, like a broad topic which I can actually take. I don't want to concise, or I don't wanted to only concentrate in dentistry. I wanted to explore everything in public health so that I can actually teach all the students. Like if I get an opportunity, I'll actually teach dental students. If I get an opportunity, I can teach MBBS students. So teaching is my, I think I can be a very good clinician also. I'm confident in that. But I wanted to continue my, after 35 years or 40 years, I really wanted to like continue my journey towards teaching so that I can actually upgrade all the people in the world. So that was my intention actually. So I know that there is net exams and all, but I wanted, like, I don't want anybody to say in future that you could have taken PhD so that you could actually worked there, you could have got this much salary. I don't want anybody to tell me that. So that's why I took a decision that nobody have told me about this. I myself will do it. And just the way, like, just what you have said, sir. Actually, after completing my BDS, it was tough for me to say to my faculties that, okay, I'm going to do my master's in hospital administration. Everybody, like, there were times that after completing, after graduating, I went back to my college. Then I told that I'm going to do my master's in hospital administration. All the teachers were surprised. They were like, why are you going to take in hospital administration? You can actually take in pediatrics or oral maxillofacial surgery, or your favorite subject, public health dentistry. But I was like, no, I think this is the main thing which I really wanted to do, because I know that I'm confident in talking to people. I'm confident in leading the institute. I can actually manage time, people, resources, and all. So I thought, okay, the best way, like, best thing is like, I wanted to know more about the hospital management so that I can be a admin. I can actually lead certain people. So that was my intention, actually speaking. And also I had some of my, like I have still, the dream is there that my mother is also MPBS, so she is also consult, like she's also a visiting doctor, visiting physician. So I thought, okay, I have to build a hospital. So to build a hospital, you have to know the other aspects also. We know about our clinical things, but we don't know about the management or how they are managing the budget, the time, the resources, and all. So if I know certain things, I can be the head in future with the experience. So that is how I end up in masters in hospital administration. As I already said you, my college, like SRM University, have given me lots of opportunities. Actually speaking, they have sent me for all the rounds in the hospitals, and I have came across, like I have gone for all the workshops, or like I have got all the exposures, like talking with all the doctors, talking with the employees in the hospital. So mingling with all those people, I came to know that this is a stream where I can actually be a leader. So
Absolutely.
that's how, yeah, that's how, like I thought, okay, this is a good part which I can actually concentrate. Then all of a sudden, I told you, no, all of a sudden I came to know that, okay, there is admission in Ramachandra. Okay, PhD admission is going on. Why can't I just try? Because I told you, no, there should be a discipline in life. At some point, after 45, 55 years, I don't know whether I'll be very creative and all, because in quality department, if we are working, or in a hospital if we are working, I don't know, we have to be creative all the time. We have to like upgrade. Of course we have to upgrade. We have to learn many things. Actually, there will not be an end for that. But still, I wanted to concentrate on teaching, and also I wanted to explore in researches. I wanted to know more about it. After COVID, people came to know about public health department, community department, and all. Before that, also there is this department which was working, and nobody knows about it. So I thought, why can't I work? Why can't I actually be a star in that? So that's what. That's why I really wanted to explore the research project field also. It's not only money based. It's like I wanted to explore. I wanted to know about more equipments, more softwares, which people are dealing in the research field, especially in the medical research field. So that's how I came up.
This is brilliant. So your motive behind doing PhD, like teaching, is a noble cause. Absolutely. You can teach so many generations of researchers. And the attitude, which I can speak on behalf of Empowering Science Foundation. So we believe in breaking the barrier. And one of those barrier is this, that people think that researchers are only who are doing PhD or who have doctorates of any kind. What we believe is anything, the attitude is of researchers, your attitude, like say, in future you want to build up, a hospital, but you want to know all the basics of it, like starting from the infrastructure to the top management. This is the attitude of a researcher. So when you come up with that, okay, I don't want to fail, I want to do the best I can, and to prepare yourself for that, this is what you choose. This is marvelous, and we give you all the good luck for that. Now we will talk about the second part of it, that as you mentioned about the community medicine. Okay, you already have a degree, you are doing a PhD in public health. How you see that, what are the potential challenges which you will face, and how you have prepared yourself to overcome those? Because this is at this point of time hypothetical. You might have already faced some challenges till now, how you have overcome those, and then how you prepare, because this is something what we want from this researcher celebrity series, that the people, the audience who are listening to you, when they feel that okay, they are stuck in similar position, how you have made your path to walk through, so that it can help them to clear their path.
As I have already told you, my PhD was all of a sudden thing. So I didn't had any sort of topic in my mind. I didn't had any sort of topic. I didn't had a view about my guide, or in which under whom I have to do and all. I had only my like the mindset was like, okay, I'm doing it in Ramachandra because I got a mail that okay, I cleared the exam, I got this rank, and I was like, okay, I am attending an interview. So during that interview, also my dad asked me, how was your interview? So I was like, no, I'm going to do it. So did you already like got any information about your guide? And I was like, no. I didn't get any sort of information. Let's see. That's what my mentality was. So during my interview, also, I still remember that the proctor actually asked me that, okay, do you have anybody in your mind? Have you actually researched about the guides? I told no. I don't have any sort of idea about my guide. That was not something which actually pricked me. I'll genuinely tell you. I know many researchers will actually go through the CVs of the guide, go through the what and all publications they did, and how their behavior is in the college. They actually research about that initially. Starting from that itself, they will start their research. But I was not like that. I told you, no, I only, like, I didn't fixed any of my topics. But during my interview, they asked me in which background you wanted to do your research. At that time, I had only one condition, that I wanted to do something which is related to dental. That was the only concern which I had, because that was my base. So my base is, I know that my base is good. So I wanted to do something, because nobody should tell me that, okay, I left my BDS or left my dentistry world. I don't want to hear that. So not only like hearing, I don't wanted to regret myself that, okay, I left my dental degree. Because during my dentistry also, I was really a star. I still remember that people will call me that obese doctor. Can you just call her, because she really smiles, so she'll always laugh. So it's like, we will not feel any sort of pain, because for so many hours we have to open our mouth and sit, so we don't have any pain when she is doing our procedures. So that was my identity. So I don't wanted to destroy my identity. So I thought, okay, I wanted to do it in the dental department. As I already told, that I don't have any idea about my guide. Even when I visited my HOD of the department, he actually asked me, do you have any idea about your guide? I told, no, sir. I am actually a person who can live with any sort of situation. So I told that I don't have problem, sir. So in Malayalam, can I say in Malayalam?
Yeah.
It's like we can, even my doctor, like my senior doctor, where I worked in dentist, like as a dentist, he have told me that Adisha is a person who is like Veenadam Vishnu Logam. Like wherever I fall, I believe that it's a Vishnu Logam for me. That still continues. So, certainly, it is like continuing in my life. Actually, I'm doing that every single day. The challenge which I faced is like, I had lots of situation where my guide or me had some variations. Like, for example, his mentality will be different, because he's an elder person and also he have lots of experience. But I am a very vibrant person. I'm like enthusiastic. I'm like very jolly person, very like enjoyable. I can talk with anybody. I don't have any barriers. I will explore myself. So there are certain conditions, or there are certain situations which I have faced in my like 1.5 years of my PhD, that my guide had some confusions that what topic we'll decide for Adisha. So I told him he's from a biochemistry background. So I told him, sir, any topic is okay for me. I can work in any topic. I don't have problem in that. But I really want you to just concentrate, like at least 40 percentage of my topic have to be a dental background. I wanted that, because that is my base. I know certain things, sir. And also I can connect you with my, like, I need an REC member, of course. So I can actually connect that with my teacher, who actually supported me during my dentistry. So she really supported me in all the things. So even though I faced some challenges, they were helping hands for me. all the time. So that is important. We should need certain people in our lives. Correct. No, we should actually need some help. So if I am getting that, even though I am facing this challenges, like I told, no, my guide is not from this background, so he does not know about my specialty, and even I don't know his specialty. His specialty is something which is like extraordinary, and I don't know about that. So I told him, I literally told him, sir, I am really zero in your topic, but I would like to learn about it. I'm really interested in that. So he was like, okay, let's decide then. So that's how, that was a challenge which I faced.
Mhm.
I don't know, everybody will be like, they will have a plan regarding their guide, their topic and all, but I was zero in that. But now I am 50 percentage upgraded in that, so I'm really happy. So after completing my BDS, it will be 100 percentage. So that is my confidence. So that make me like, okay, stepping like step by step, I am actually upgrading myself, and that is important, I guess. So
Absolutely.
that's,
There is a famous saying that you don't have to see the path for 1 mile. All you need to do is one step at a time, and then
yes,
just you will see miles in there. So this is
yes.
for all the audience there, that Adisha is one of our first researcher celebrity in this sense who jumped into the field of research without defining a lab, without defining a topic or even a PI in mind. She is driven by the passion to serve the society, to make them laugh because she herself smiles and she wants everyone to smile. Even when there is a procedure included in what Dr. Adisha just shared with us, that people used to call her so that they can get through with their procedure. This is something which can only come when you are so much self-confident. When you are confident about your abilities, about your capacity, and about the environment you are going to work. This is one of the basic principles which every human being, especially when it comes to research, should be able to connect with. Because when it comes to make people laugh, it is easy. But when it comes through challenging yourself to make them laugh, because now you cannot make everyone happy. There will be people who will be pissed at you, especially when it is about hospital administration. You cannot make patients as well as administration happy at the same time. And as we see and we understand that, Adisha, this is your future goal and long term that you want to establish your own. So now let's talk about the discrimination, or I will say that how people see in India is this topic coming up, like how people talk about women in STEM. What were your experiences in different degrees, and now when you are a PhD student, how you see that? Do we need to debate on women in STEM in India?
Hmm, I didn't get you actually speaking. Woman in STEM in the sense.
So they say that, oh, the research or STEM society is like overwhelmed with only males. They are dominating the field. So
Okay.
people now talk about that women empowerment, empowering
Yeah.
celebration,
Okay.
breaking the
I,
barrier. And this is something which we still feel some of it is not true for all the organization, but still the general consensus is that people start talking about women in STEM. What are your
yeah.
thoughts in it and your experiences with that?
I think for that, the answer is like, I never compare me with like a woman or male. I have that equity towards all sort of gender. So I never thought about empowering women and all. I don't think that we have to give certain power to women to establish certain things. They are also equal, and they are one of the genders which is present in this society. So it's there, like everybody should be confident enough to do certain things. It's only that they have to ask their mind. what sort of things which they wanted to establish or they wanted to innovate, and come up with it. It's not like this person only can do it, this person cannot do it. For me, it's not like that. For me, everybody is equal, and I don't think like we have to make ladies or women to come up to this research field. It's their wish to come up, like it's their thing. If their mind says that, okay, I am actually like, I am a person who have to be a researcher, I wanted to research my topic in this stream, so if they are interested, they have to come up. There is nothing like, okay, the women have no such they are not getting any sort of power, or they don't have any sort of new opportunities. It's not like that. It's like, if your mind says that, okay, you have to do a research, they have to come up. And I think equity is really important, and we have to give equality to everyone in the society. And also we have to strive, that we have to survive with that. That is important. The woman's problem, I'll tell you, according to Indian culture, woman's problem is like, up to 35 years they will work very like creatively. Then after that they will be like, no, we have lots of work to do, we have our own family. The male people also have the family, so they also have to, they are also looking after, so they also have stress, they also have that everybody have that, everybody have the same emotions. We are just actually making that into like, we are actually dividing all the emotions according to male, according to female. That is actually wrong. For me, it is actually wrong. I think there should not be like, whatever you're saying is correct only, sir, according to Indian culture. But for me, I think that equity is important, so that people can actually do whatever they want. There is no gender, there is nothing like nothing like that. I don't have much answer for that, because I am not a person. I never used to, I told no, I never used to compare, and I never used to what to say about it. I never used to group them. I never group this gender based, or like they are ladies, or they are women, they are men. I never used to compare, or they are transgenders. I never used to do that. Everybody is a human.
Yeah.
Everybody have their own perspectives, their own innovative creations, or anything like any emotions. They have their own things. So it's their liberty to showcase their personality or their character. So they have to come up.
Absolutely. And I wish that more of our society is so inclusive, as you said, Adisha. And this is no wonders to me now, because when we started this conversation, starting from you have never compared yourself with anyone. So all your comparisons are yourself with yourself, that how I was a year ago, a day ago, a month ago, and now how I want to improve. That is
Yeah.
something which I believe gives you this confidence and independence also. And at the same time, it liberates you from any other stupid comparison with the community, with the caste, creed, or anything. Absolutely.
Yes.
Now, what we also know that no professor has spoon fed you during your masters, and that was one of the reasons why you excelled in it and received the gold medal.
Yes.
Now, for PhD, if we see that how it's been 1.5 years for your PhD, and then how is it going? And then the second important part, which will be like you mentioned that taking charge of yourself, like again, becoming a more independent researcher, especially in your case when the supervisor is not very well, you know, equipped to guide you. So you have bridged it perfectly with your previous teachers from your dental college to come together and build a hybrid, you know, project. So how you suggest to our viewers, if some of them are facing challenges that, oh, I am not able to find a supervisor or my previous supervisors, how to bridge them, and what are your guidance and suggestions for them?
First of all, for selecting a topic, if you have certain things in your mind, like, okay, I have to concentrate on my base, or I have a topic in my mind, that is good. If you have a topic in your mind, that is good. But you have to just process that with your guide. So if you have already selected a topic and also you have selected your guide, you have to try to convince your guide in such a way that, okay, I wanted to do my research under this. So that is something which we have to learn, and that is something called as adjustment.
Mhm.
And adjustment is really important, even for a researcher. It's not like you're adjusting for your life. You can actually, after your PhD, my mentality is like, after your PhD, you can work in any of the stream if you're interested. You only need a knowledge about that. You only need a base, or like you have to know about it so that you can do it. Everybody is like, everybody can read, everybody can collect informations at any time. So you can work in any of the stream. But the thing is, like, if you are very confident in your topic, you have to start convincing your guide. Or if the guide is not being convinced, you have to convince yourself in such a way that your guide is interested in this, your guide really want to do it in this. And at the same time, what you have to do is, like, if you have your own wishes, you have to implement that. What to say, like an earthworm, you have to go inside. It's like a soil, you have to go inside, somehow you will come up.
True. So,
Correct, no? Somehow you will correct up. So, you will come up. So that's what. So for me also, I have chosen a guide who is from other specialty, but still I found out a way that I can actually put my own topics in it.
yeah.
So that is how, even though we have to be very friendly with our guide.
Mhm.
So my luck is that my guide is actually strict. But at the same time, I started convincing me that I have to finish under him.
Mhm.
I wanted to do it under him. I don't want to change my guide, or I don't wanted to showcase me in such a way that I'm not, like, I can adjust actually. So I wanted to showcase that I
Mhm.
can adjust, and I have did my PhD
Nice.
and PhD in this particular topic with my own wishes, or like my own like perspectives, or the topics which I really wanted to concentrate. So that's how I actually did it. So the to the researchers, what I'll say is, like, if you have 60 percentage, if you're confident enough about your topic, just start convincing your guide. If your guides are not convinced, you start convincing yourself. And what you have to do is, like, you have to upgrade yourself. You have to know about the topic which your guide is insisting you to do, so that it's an added advantage. Just like I told you that my masters was something which I fed myself. Even my HOD in my master degree used to say that, master students, we cannot spoon feed you. That was one brilliant sentence which still it has been present in my mind, because I came to know that it's actually a real thing which he have told us, because we have to just learn ourselves so we can actually be a top person in that specialty. So that is why, even still now, I know that so many students, whoever is joining this master degree in SRM, especially in MHA, they are actually approaching me,
Mhm.
because my faculties know about me. My faculties will, I think, 50 percentage they are proud about me because I learned myself, and they actually helped me. I used to ask them certain questions, like, I have lots of doubts, so I used to ask them, sir, what is this, what is this finance, I don't know about this accounts are very new to me, I really don't like mathematics, and finally I am ending up with mathematics. Whatever you don't like, anyway, somehow it will come in your life. So I understood that, okay, somehow it will come into your life, you have to learn about it. You have to adjust yourself. So that is how I actually struggled. That was a challenge which I faced my master degree. But even though I faced also, finally I got the result in such a way that I made my parents or nobody else, I made myself proud that I finished my masters in such a way that I got wonderful marks in every subjects because of only me. Only me. It's not because that chumma they are giving me marks and all. It's not like that. Simply they are giving me marks. No, it's not like that. They actually, I struggled a lot and I got it. So even though PhD is also a struggle,
Yes, absolutely.
PhD is actually a struggle. You have to like, we cannot complete that within 3 years.
Yes,
Cannot complete that.
true.
So it's a actually real story which I'm saying to everybody. We cannot complete our PhD within 3 years. It's something which you have to understand yourself that your PhD is something which will take time.
Mhm.
It's not according to your guide or according to your situation. Anyway, it will take some time. But it's your cleverness that you have to find some funding. You have to just be into like any research project. You have to work under that, and you have to start collecting your samples or whatever you want. So finally, what will happen is like finally it will also end up in such a way that you will be proud about that
Absolutely.
after 5 years. So
Yes.
for me, I'm targeting 4 years.
Mhm.
So I know that if I'm targeting 4 years, it can be 5 years. I don't know. But the thing is, like, I will start seeing all the fundings. Now, also, I'm actually seeing fundings. I am working in research projects. So I am really happy for that
Nice.
because I'm not only concentrating myself into my PhD. We can actually be a part of a project also. We can be a junior research fellow also. So that not only we are earning money, we are earning some sort of knowledge in
Yes.
that field also. So that is important. So this is something which you have to, like all the researchers have to see that PhD is something that we are stepping ourselves very slowly and we are getting all the knowledges. So it's like an asset, it's like an investment. It's
Yes.
a lifelong investment. In future, you can actually guide so many students. You can tell about your PhD, and you can actually do some creative things with your guide, with your what with your students. So that is what my thing is, and my I think my ideology is really brilliant, I guess, because uh, because I think we have to somehow know the reality. We have to be like, what to say, we have to be realistic. So that is really important.
That's what research teaches all of us, that be more realistic, break
Yes.
barriers, and move forward. With this,
Yeah.
we'll say very much to thanks to you, Adish, and to all the viewers who say you can see and probably correlate with the passion, enthusiasm which Dr. Adisha brings to researcher celebrity. I can tell you that she is a brilliant teacher already. If you need any guidance from, you can write it to her, or if you want Empower Foundation to help you, we are there to bridge you with our celebrities. Stay tuned for Researcher Celebrity, another episode. And thank you very much, Adisha, for
Thank you so much.
spreading so much of enthusiasm and positivity and smiles to the series. And we wish you all the good luck.
Thank you so much, sir.